Picture this. It's 2 a.m., your head is pounding, and the only thing standing between you and sweet relief is a bottle of ibuprofen that expired 3 years ago. Now, you're faced with the ultimate question. Do you take it, or do you endure the headache, wishing you'd gone to bed earlier? Before you make that call, let me tell you the truth about expired meds that may shock you, especially when the US Army gets involved. Medicine's expiry dates might not mean what you think they do. Let's unpack the mystery. What do expiry dates really mean? Okay, first things first. What's the deal with those tiny expiry dates stamped on every bottle? Are they there to protect you, or are they just a sneaky way to make you buy more meds? Here's the truth. Expiry dates are not a magic switch that turns medicine into poison after midnight. They're the manufacturer's best guess about when the drug's potency starts to dip below its peak. Think of it as a best before rather than a do not consume after. They're telling you the drug will work best until that date, assuming you've stored it properly. After that, they're washing their hands of any responsibility. But here's the kicker. The Shelf Life Extension Program by the US Army and FDA analyzed over 100 medications stored under ideal conditions. They found that 90% of them were still effective even 15 years past their expiry date. Crazy, right? So it's partly about safety, but also, let's be honest, economics. Big Pharma doesn't exactly hate the idea of us restocking medicine every year. Pain relievers, the headache heroes. Let's start with the shelf superstars, pain relievers like ibuprofen, aspirin, and acetaminophen. These little lifesavers are pretty stable over time, especially if you've kept them in a cool, dry place. But here's a fun fact. Aspirin can break down into acetic acid as it ages, which is why an expired bottle might smell like vinegar. If your headache cure smells like salad dressing, it's time to toss it. Now, while it might not harm you, an expired pain reliever could lose some potency. So if that headache doesn't go away after popping a pill, don't blame the universe. It might just be that the drug is running on fumes. And hey, I'm not an expert, so if you're ever unsure, your pharmacist is just a phone call away. Cold and allergy medications, the sniffle stoppers, the unsung heroes of flu season, antihistamines like loratadine and decongestants like pseudoephedrine. These guys have a bit of a mixed reputation when it comes to expiry dates. Antihistamines tend to hold up pretty well over time, so if you're battling the sniffles and all you've got is an expired bottle, chances are it'll still do the trick. But decongestants? Different story. Over time they can lose their oomph, leaving you with a nose that's just as clogged as before. So, if that expired decongestant doesn't seem to be cutting it, maybe it's time to let it go. Or, ask your pharmacist. They love talking about clogged noses, trust me. Now let's get real. Speaking of pharmacists, what's the weirdest question you've ever asked one? Drop it in the comments. And if this video is helping you clear up some medicine cabinet mysteries, don't forget to hit that like button. Otherwise, I'll expire before my next video. Don't let me go the way of that old aspirin bottle. Antacids and digestive aids, the stomach saviors. Ever reach for Tums after a spicy taco night, only to realize they expired last summer? Don't panic. Antacid tablets are surprisingly sturdy. They might harden or crumble a bit over time, but as long as they haven't turned into a science experiment, they're probably fine. Liquid antacids, on the other hand, are a bit more high maintenance. They can separate or lose effectiveness faster than their solid cousins. So, if your bottle of antacid looks more like a snow globe, it's probably time to say goodbye. Topical creams, the skin soothers. Finally, let's talk about those tubes of topical creams. Antibiotic ointments, hydrocortisone, antifungals. These are lifesavers for cuts, burns, and itchy rashes, but they don't age gracefully. Once opened, they're exposed to air, moisture, and bacteria, which can speed up the degradation process. An old tube might not harm you, but it could be less effective at fighting off an infection. And if it's crusty, smells weird, or has changed color, do yourself a favor and toss it. Your skin deserves better. So wait, before you throw that bottle of expired pain relievers away, ask yourself this. Are you tossing medicine or just falling for a date on a label? It turns out that in most over-the-counter meds, an expired label doesn't mean it's instantly useless or dangerous. Pain relievers and antihistamines can often outlive their expiry dates, but liquids and creams? They're more of a gamble. Medications don't suddenly become harmful, but potency might decrease. The exceptions? Liquid medications like insulin or nitroglycerin and certain antibiotics like tetracycline, which can degrade into toxic compounds. And here are some additional tips to figure out if it's the time to toss. It's liquid and separated or cloudy. The medicine smells funky or has changed color. If it's for life-threatening conditions, don't risk it. And look, I'm not the expert here, just a curious soul trying to help you make sense of those tiny labels. When in doubt, talk to your pharmacist or doctor. Seriously, they love this stuff. Now that you know the truth about expiry dates, it's time to give your medicine cabinet a glow-up. Toss the crusty creams, check the vinegar-smelling aspirin, and remember, pharmacists are basically the superheroes of expired meds. Oh, and don't forget to subscribe and hit the bell, or this video might expire before you watch the next one.